family physician at Reach Community Health Center in Burnaby, British Columbia. Dr. Narang is on the steering committee of the South Asian COVID Task Force and is a founding member of the This Is Our Shot Vaccine Confidence Campaign. Welcome, Birinder. Thank you for joining us today.
Thanks for having me. Good morning.
Thank you. So I'm going to start with a question that has been on all of our minds. Why is it important for people to get the flu shot, even if you're already vaccinated against COVID?
Yeah, so it's a lot of question that we're being asked a lot this year, and I think it's important to remember that getting the influenza virus and the COVID-19 virus they're caused by two different viruses. So there's a SARS-CoV-2 virus which causes COVID, and then there's multiple influenza viruses that can cause influenza. And so if you get vaccine for one, it's not going to protect you against the other. And it's important to realize that initially, if you get symptoms, you can't really tell which one you're getting. And so by getting your influenza vaccine early, you can not only protect yourself, protect people around you, but also make sure that you're helping to keep that pressure off the healthcare system where we know that there's already so much strain.
And you mentioned getting the flu vaccine early. So I've been reading in a number of articles that they've been recommending that people get their flu vaccine by the middle of December. So is this true for Canadians? And is that sort of when we're expecting to see the most flu cases?
So generally, I haven't read the December thing myself, but why I think they may be saying that is because the peak of the flu season generally is around that December to February time range. Although it generally lasts, the entire flu season is usually around November to April. And so what we do know is once you get your vaccine for influenza, it takes a couple of weeks for you to actually build that antibody response to have that protection. So I imagine why they're saying that is so that you're ready for the peak of the season. But we've been giving vaccines since October. And, I would just encourage people to get it as soon as possible. We're already into December now. So even if you get it now, you'll get your protection just before Christmas.
And as a family physician, you understand the importance of your patients speaking to you before they start any sort of new treatment or medical medication. So with the flu shot, are there any specific populations of patients who should be speaking to their family physician before getting a flu shot?
Yeah, so, as I think about that, I also think about who are the populations that absolutely should get it who are inherently at higher risk. And so I'm thinking about people, young children, people who are pregnant, those who are elderly, certain like lung, kidney, heart diseases. And those who are able to transmit the influenza virus, so those who live at high risk, so who are the vulnerable people with us, and people who live at communities, working essential community services with high risk populations. So those are the people who absolutely should get it. Now, people who have traditionally had concerns about vaccines, there's a few subpopulations. So there are people who are pregnant. You should definitely not be getting any type of live vaccine. And that's generally a principle that we carry against all vaccinations. And NACI, or National Advisory Committee on Immunization, has put out strong guidance that, even me coming through medical school, I was taught if you have a severe egg allergy, you should avoid the influenza virus. But that has been disproven now. There's lots of evidence that it's safe, even if you have anaphylaxis to egg product. It's safe to get the influenza vaccine. The last one I want to mention is there's a certain syndrome that's called Guillain-Barre Syndrome, which is like when your immune system goes into overdrive and starts attacking some of the peripheral nerves in your body. And so people, if you've previously developed Guillain-Barre Syndrome within 8 weeks of getting a previous dose of an influenza vaccine, then it's best to avoid it. So if you have any of those concerns, definitely speak with your family physician.
Great. And can you explain, how does the flu shot actually work? And will it protect us 100% from getting the flu?
Well, I would just say it's magic, and then we'll leave it at that. No, it's all vaccines.
You're going to have to tell us a little bit more than that, Dr. Narang.
So, seriously speaking, so what is our immune system always doing? Essentially, it's looking for kind of foreign invaders in our body, and those are kind of germs or like something that the body doesn't recognize as a safe space. And so that's essentially what the whole principle about vaccination is. Now, there are different types of influenza vaccines. Like I already mentioned, there's the live attenuated vaccine, which most commonly is available as the flu mist nasal spray, indicated for most children. That and 2 to 17, that's a live vaccine. And so that is a weakened, or what attenuated just means weakened version of the vaccine, which your body will recognize as foreign and will then stimulate your immune response. But most of the vaccines that we use are actually not live vaccines. They're inactivated vaccines, which means that they're killed. So they're killed vaccines. Your body will still recognize them as foreign and will stimulate that response. Now, there is no vaccine that will give us 100% protection. And so the effectiveness of the flu vaccine for this year, we're not going to find out for a couple of months from now, because the preparation of the vaccine changes every year, and it goes based on what is happening in the rest of the world. So we know that the influenza virus is predominantly related to travel. So what we look at what's happening in the southern hemisphere, what are the strains that were circulating them in the previous flu season, and because of generally open travel, which we'll get back to not necessarily being the case in the past couple of years, that is the strain that they can transmit to the northern hemisphere. So we generally are pretty good at predicting what strains will be around, and if it's a well-matched vaccine, which a lot of the time it is, it can give you up to 60 to 80% protection.
So I want to touch on two of the points you mentioned. So one of them was that the influenza virus and the spreading is affected by open travel. So one of the things I kept hearing last year was, well, the flu disappeared because of COVID. So why are people saying this? Is it partly because we weren't traveling like we have been in previous years? And also, my opinion is because people started washing their hands and wearing masks. So what's your medical opinion about why people are saying the flu disappeared last year?
Yeah, I mean, I guess it's a terrifying thought of how much people might not have been washing their hands before. But yeah, so I'm in BC, as we said. There was only one case of the influenza virus in BC last year. And when we look around at it nationally, in the 2021 Canadian influenza season, there were only 69 cases. And that percent positivity, so like the chance of testing positive, was 0.1%. Now, I wish we could get COVID to that, but you're absolutely right. Travel bans, or the travel bans that existed last year, was a huge part of that. There were also regional stay-at-home orders. All the stuff we've been hearing to protect ourselves from getting infected with COVID also applies to the influenza virus too, when we're talking about washing our hands, physically distancing, not going out if you're sick, wearing effective masks. So all of that helps, and that's why we were seeing a lot less of it. Now, we're seeing a bit of a change this year. Mm-hmm. I mean, we haven't seen any significant resurgence yet. I had a look last night, in BC, we've had about 123 cases in the season so far, and knowing that we're a couple of months into it now, or maybe 6 weeks or so, there have been 123 cases in BC, and when we look at it nationally, we're seeing about 20 to 40 cases nationally right now. So let's say, just looking at the last amount of data available, there are in the mid-30s cases that were found. And an interesting stat that I saw, and I don't know how reproducible this is or how it will be going forward, is that 91% of those cases were in people under the age of 44. So, it's interesting, doesn't surprise me. That is a population that's going to be getting out there more, socializing more, also working in kind of frontline jobs where they might be placed at higher risk of actually contracting viruses. But definitely something to keep in mind if you're looking at your own vaccination or your household vaccination status.
So clearly there's been an increase in influenza cases from what we saw last year. So is that why there's the fear of a twindemic? So we keep hearing, get your flu shot because we don't want a twindemic. So can you first define what is a twindemic and why the flu shot is so much more important this year than it probably was last year?
Yeah, no, absolutely. And I think that there are very real concerns from it. Let's define the term. I mean, pandemic, we all know what that is. We've been living in it since March 2020. Twin is just a way of playing on the fact that there are two viruses, the influenza virus and the COVID virus, and both have potential to do some serious harm to people, especially, like we said, those that are vulnerable. Because there is increased travel, there's increased mingling, there's also an increased kind of push in society to reconnect with each other right now, which, I completely encourage. It's about how do we kind of mitigate those risks as much as possible. And, we're very fortunate in Canada that we have really great vaccination uptake across the country, but it's not perfect. But when I look at the twindemic potential, I worry about our neighbors down the south. We know that even in the last week, their COVID-19 numbers and deaths have both gone up by 44%. And there's an incredible strain and burnout in the healthcare system. And influenza has definitely the potential to cause severe illness in people who have underlying conditions. So we look at the impact on the society, on the on the individual, the community, and on the healthcare system again. And definitely there is potential for both to do damage. So definitely get your influenza and your COVID vaccines.
Thank you. So we have an audience question, and this is relevant to COVID. So Dave from Halton Hills has a family member who's unvaccinated against COVID-19 and asks, is there a risk in us getting together with an unvaccinated person, or is the threat or danger really more to them because they're the unvaccinated person?
Yeah, so I think I would look at this from first principles. Like we said, there is no vaccine which is 100% protective. In saying that, the COVID vaccines that we have, and I don't know Dave's specific vaccine combination or timing or when he got it, but we know that they have been amazingly protective at severe illness. And so, I don't know what your age is. We are seeing breakthrough cases which are happening, especially in over the age 60 population. And there's a lot of evidence, even this week, that evidence that is showing how protective boosters are, and how we might even need to start thinking about this COVID-19 vaccine series as a 3-vaccine series. And so when I put that all together, the risk is not zero for you and your family, Dave, but it is much lower. But the risk is definitely higher to that unvaccinated guest. There are ways that you could mitigate it, which are not perfect. I mean, if you have access to a rapid antigen test, you could get that done prior to the gathering, just to add that extra layer of protection. Again, I don't remember where your the question came from, but depending on how the weather is, ensuring where you're doing your gathering that there's a great ventilation is important. And definitely in Canada, in some parts over Christmas, that is not feasible or practical to be doing it outside or with your windows fully open. So it's all about risk mitigation as much. And the last point with that is I would just I would see what your guest's comfort level is and what their job and activity is. Are they working in a condition where they're likely to be exposed to it? Are you living in an area where there have been a lot of community transmission? I think you have to weigh all of those things before you make that decision.
That's great advice. And just before we wrap up, you were one of the founding members of the This Is Our Shot campaign. So are there any last words or pearls of wisdom that you could give to our audience that come from the campaign, or sort of what you're trying to get out to the masses?
No, I think it was a great experience. I think on a personal level, I learned about the power of grassroots movements and how impactful they can be. What I would always encourage is, no matter how hesitant you are to whatever vaccination it is, speak to your family care family doctor. And if you don't have a family doctor, even attending an urgent care clinic or a walk-in clinic or a digital provider at this point would be a great idea. We're all trained to have these discussions. There's no judgment in the discussions. We're just here to support you and help you ease your concerns and help you make the decision that's best for you.
Amazing. Well, thank you so much, Dr. Narang. I know that was very helpful for me, very insightful, and it was wonderful speaking with you this morning. Thank you.
Have a great day. Thank you.
You as well.